Yeah, so let me just quickly do this video because I'm trying not to make them so long, so I'll just cut them short. But this part, I want to talk about. I want to talk about the patients. This particular part, and I want to talk about really, because you know, I remember. Some people probably remember. Some people probably remember even further than the Lister unit that was. I think it was on the grounds of Norfolk Park. I think we shared it with, I think it's tropical diseases, but it was a unit, and in this unit, I think there was a few floors, and I'm not sure if we had 2 floors, but I know that we had St Mark's, intestinal failure patients were on there. We had a couple of nurses. It come up we had one. It was 1 nurse to 2 patients or something like that. But it worked, I don't recall us having breakouts of diseases and bugs and infections. And I'm sure there was another part of there where it was more for long-term people, probably that were really poorly, that would probably die. Do you know what I'm saying? And it was like that. It was like that, And obviously something changed. I don't know if it's because it was cross-contaminating, because we shared the block with those people, with another department, which was the tropical diseases. So that's kind of cross-contaminating, isn't it? So maybe they put us to the main hospital on the 9th floor, the IFU, Johnson Ward. That's where they then put us, right? And more beds, by far. More demanding, I'm sure. And more bugs and stuff like that. Do you know what I mean? But what I do remember about the Lister unit is that, like I said, it was less of everything. Do you know what I'm saying? It was definitely, you got the care, obviously. It was one-on-one sort of thing. But what I notice now, if we speed up to 2022, like the present day, right? I have to sit down and say to myself, where are we? Like, what is St Mark's stand for, really? I don't understand. Is it like a hospice? Like, how long do your patients occupy a bed in 2022? Because I know years ago on the other ward, you would have patients that would be in your hospital for a very long time. For a very long time. We're not talking about a couple of months, maybe a couple of years. That's kind of like a hospice kind of thing, right? Or I don't know, palliative care, or whatever you want to call it, wherever you go after that. Because you're confused, and this is what I'm talking about. What is St Mark's really? Like you come in, you get, they treat, and then you leave or whatever, but it's not, because like I said, I've never even heard of a hospital that even have patients stay for, you can stay there for a couple of months and stuff like that, and then you get some patients that stay for like, I don't know, a year and a half, or even like a prison stretch. It's like, doesn't that fall into like a hospice kind of thing? Because anything goes with St Mark, so that's what I'm saying. It's so disorganized. You're so disorganized. Like, what the hell? Don't you think the patients are confused or scared, and then they can't ask you anything because you've got no answers for them? Don't you? I'm confused. I think about that. Obviously, and like I said, on this particular stay now, I've seen bays that's got beds in there, empty beds in the bay. And then when you're walking by, you see some other beds, some other beds. Can you imagine all the people that's over there at the other hospital where I come from is trying to get over here, and still they can't get over here? But you've got beds. Those beds were already here before I came here, and those people were already over there. How's that making sense? Which is all about cutbacks. This is all about the funding. You know, it's always been terrifying that I mentioned before, briefly on a video, and I mentioned about at the beginning of time when they decided to do the fundraising and stuff like that. You know what they should have done? Patients ourselves should be taking money out of our money. I don't care how much money you got. I don't care if you're rich or you're poor. There should be a certain amount of monies that should come out of our money. You hear me? Whether you work or you don't work. And it goes into this automatically. Do you hear me? And it goes into this hospital automatically. Our contribution, without, not a case of just like, oh, you know, do a donation. No, we should be automatically. Do you understand what I'm saying? Because you know what, it's better they go private, because it seems like, you know what, if you're not paying, then you can't say shit. You got no voice. Do you hear what I'm saying? You got no involvement in it. So don't you feel controlled? Don't you all feel, how can you, what, you use it don't feel controlled? Like some kind of guinea pig. You don't feel like some kind of experiment. You just don't feel like that. I'm surprised we don't have a system like that, aren't you? Where we, like I said, where we pay, we contribute to our healthcare, like you would if you was anywhere else. Especially when it comes to St. Mark's, look at the funding that they get. How come they haven't made it like compulsory though? Don't you think about that? Why haven't they made something like that? That we are a part of. Towards our own healthcare. I don't understand why not. But then it makes sense, like I said in another video again. Because this system, this particular area, the intestinal failure, whatever you want to say, the whole St. Mark's thing, it wasn't designed to save us all. It's not designed to. They can't. They can't save us all. But you know what's disturbing? And what's scary? If some of this money went into funding other hospitals to do training and stuff like that, you kind of get a better chance, right? You don't have to take on all the responsibility if you've got no room for us. Then why isn't some of this money you're raising going into training these other hospitals? You can't just keep it all to yourself and then not take care of us all. Or you haven't got room to accommodate us all. It doesn't make sense. Otherwise, what are we supposed to do? Or is this what is happening right now? Is maybe this is just it? All these struggles, all this bullshit, all this medical negligence. This is exactly what it is. It falls under all that treatment. Lack of. It's a sham, it's a mockery. It's not okay. We're being neglected, and that's how I see it. I sometimes wonder if we were contributed, would we be treated that same way? You wouldn't, would you? You've got your private clinics, haven't you? That's why I always say to people, think about it. What's your plan B, patients? Whilst you're umbilically corded to St. Mark's, what's your plan B? Your plan B is them. Your plan B will always be them. You hear me? Until the day the good Lord takes you. Your plan B is them. Do you know what their plan B is? They've got the clinics. They've got other patients that can keep on going around the conveyor belt. How about that? How about that? So half of the time I sit down and think, how can patients just sit down and not say nothing? Not because of themselves, because of their loved ones too. How can they sit down and not say nothing? How can we not? It's interesting what is interesting, isn't it? As people, what we come together as. COVID, we saw everybody come together. I had neighbours I didn't even recognise before. But when it comes to certain other causes, people don't give a damn. And us patients, we're meant to give a damn. Listen, there's many reasons why some people don't want to talk for various reasons. Maybe for fear that, blah, 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 blah. But I think the truth of the matter is we've gone past that. We've gone a long way past that, for fear that. We're past that now. You can't be so selfish now. This isn't about you. This isn't about me. This is about anybody else that's going to be going through their doors. Do you understand what I'm saying? If we don't sort of get together and say, well, hold on a minute, this isn't okay here. This isn't okay. We're not going to tolerate. This can't be tolerated. We're not going to tolerate it. How can it be tolerated? Something compromising your life. It's compromising not just your life. Remember, St. Mark's are the same people that say that when you get a line infection, that's potentially fatal, you know. But yet you leave us in the incompetent hands of Norfolk Park, your finest, the untrained. That's like signing a death warrant. Are you kidding me? And we're not concerned about this, because you know, if this happens to me, it happens to anybody. I'm not that special that it can't happen to you or anybody else. I'm not that special that it's not happening to anybody else. Whether anybody else wants to talk about it, that's their business. But I know that I have to do my part. I don't give a damn. I'm not taking any prisoners. Because we've gone beyond that. What happens when you can't talk to these people anymore? They're not listening to you. What happens when that fails? It's very much this. You have to take to social media. You're trying to still get people's attention. And then you know what's crazy? Since I've been here as well, this doesn't show how dysfunctional it is, on not just on the outside as an outpatient, but on the inside too. Because if you don't keep your foot in their arses, you'll still be what you're waiting here. I noticed that. Then 1 week turns into 2 weeks, a month. Before you know it, it's Christmas, it's a new year. Do you see what I'm saying? Half of it is not because you're sick. Half of it is not because of what's wrong with you. Well, you're ill anyway, but you know what I mean? It's because they haven't done maybe they haven't put in for that scan, you know, that department, they haven't got, do you see what I'm saying? This lack of organisation is inside and outside, right? And this is the bullshit that keeps you in longer. The fuck? I'm telling you, they're having a vacation over here. The left hasn't got a clue what the right's doing, and it burns me, you know. Especially that I'm here, it burns me, you know. It burns me, you know, because I know what it's like over there. I know the bullshit that's going on over there. I know the situation they leave you in over there. I know the kind of wards that I've been in over there. That exposes me to infection, and you already got an infection. Are you kidding me, St. Mark's? Are you really serious? Because I tell you something, there's one thing with somebody dying naturally, and it's a whole different ball game setting someone up to die of some kind of, I don't know. Are you serious? You're seriously going to compromise your patient's health like that? That you know are serious? Are you kidding me? And you can just turn a blind eye? No, man. If that's the case, I'm here to poke you in your eye. I swear, I will ruffle those feathers. I will ruffle your feathers.